Hello, my name is Tim Cho. I'm the program director for the respiratory care program here at Newman University.
My name is Stacy Fox. I am the director of clinical education at the respiratory program here at Newman.
And welcome to our respiratory care lab. One of the best things about the Newman University respiratory care program is this laboratory space. It really mimics a real hospital setting and gives our students a safe, quality place to train and practice their skills, so that when they go to the hospital, they are competent and comfortable in the things that they need to do.
Yeah, so we have a lot of different options for our students, and we're really fortunate that we have a lot of community support. So everything that we have in this room, there's so many different opportunities to learn the procedures, learn the equipment that they're going to be performing on actual patients when they get into clinical sites. So they have a comfortable place to learn and get comfortable before they apply it to a real patient. But a lot of our students, when they walk through this room, they see the future of their career, right? So they are seeing all this equipment that they don't know what it is, but they know that they're going to learn how to utilize it. And it's exciting and maybe a little nerve-wracking because it's a lot, but they know that it's going to be what they utilize to take care of patients later on.
There are many procedures and interventions that respiratory therapists do, and so starting at the first semester, our students will be in this lab practicing those skills. And as they go through the program, they'll be practicing more advanced skills. One of the more complex and bread and butter items in respiratory care is the mechanical ventilator. It's basically a life support machine that helps the patient breathe when they can't breathe on their own. So over here we have a mechanical ventilator, and it's pushing gas into these pig lungs. And on this side is a relatively normal set of pig lungs. And you can see it periodically inflating and deflating, or inspiring and expiring, as the ventilator is pushing that gas. Generally speaking, both sides are inflating fairly symmetrically in this normal lung. However, over here it's a little different.
Yeah, so if you look at this lung, this is a diseased pig lung. So this would mimic someone who has been smoking for say 20 years. And if you look closely, there is one portion of the lung that is not inflating as the breath is being delivered to the ventilator. And that's because there is a tumor that is occluding or blocking that portion of the lung. So this patient would not be able to utilize their entire lung for their breathing.
So one intervention that our students will learn is intubation. And here we have a video laryngoscope, and there's a camera on the end of this, and you can see the picture over here. And what we'll do is insert this into the patient, and now you can see this upside down white U or V-shaped structure, and those are the vocal cords. And then we're going to take this endotracheal tube and guide that through the vocal cords. And now we have direct visualization of the VT tube going through the vocal cords, which then tells us that we're in the correct spot. This tube is going to be able to deliver gas into the lungs. So we'll pop out the stylet, push the tube in, cuff.
So then we are so what I did was I attached a resuscitation bag, and that is what we're going to use to deliver breath to the patient. It's called manual resuscitation. So what we have here is a procedure that we teach our students called an arterial blood gas. So that is where they have to draw a sample of blood from the artery, which is the oxygenated blood. So with this procedure, after we draw the sample, we will take it to a blood gas analyzer, analyze that sample, and it will tell us how well the patient is oxygenating and ventilating. So what's their oxygen, what's their carbon dioxide, and what's the acid-base balance in their blood. So to do this, again, you're finding your artery. So your artery is what you feel pulsating. There's several different locations, but we're going to use the radial artery, which is at the wrist. So I'm feeling to ensure I have a good pulse for my patient here. so I can feel that pulse. And so I know this is a good place to stick the patient. So then we have to make sure that we disinfect and clean the area before the puncture to avoid infection. So then what I'm going to do is I have my needle connected to the syringe, and I'm going to palpate or feel for that pulse again. And this is a good example of when it's important to talk to your patient. So you're explaining this procedure because needles are not a fun thing. And we want to make sure we warn the patient before we stick them. So once I decide where I'm going to stick and I'm ready, I'm going to let my patient know. And then I will say, here's a big stick, and then I'm going to advance my needle, and I'm going to let the blood fill my syringe. And then once I have enough sample, then I'm going to withdraw. And then I have my sample. So then I'm going to hold pressure to ensure that the bleeding stops, and then I will prepare my sample for transport and then take it to the analyzer.
One of the best parts of being part of the respiratory care program is that you are pretty much guaranteed a job when you graduate. Almost all of our students are employed by hospitals in the area upon graduation, and they often secure a job months before they graduate.
It's not just hospital settings, though. There's a lot of different opportunities for respiratory therapists. If you're not interested or working within a hospital is not your thing, there are many other places that you could work, such as pulmonary rehab, pulmonary function labs, home medical, there's asthma clinics. There's a lot of different opportunities for anyone, depending on what your interest is.
Our program is 3 semesters long, so you'll start in fall and you'll graduate the following December, the following year. So it's just 3 semesters, and during that time you'll earn an associate's degree and be able to work as a registered respiratory therapist. After you complete your associate's degree, you don't have to stop there. You can continue on and obtain your bachelor's degree, and also we have a graduate level training that exists within respiratory care. And depending on what school you go to, you can obtain the APRT, or Advanced Practice Respiratory Therapist credential, which will allow you to function similarly to a physician assistant or a nurse practitioner.
So what's great about our program, we graduate our students after 3 semesters. You have an associate's degree, and you're out in the real world working with patients with an average wage of $70,000. And so the advantage of that is you're graduated, you're working, you're making great money, and you can continue your education and pay for it along the way.